Hello, all my dear viewers of Dr. Evelyn's channel. Over decades, I've witnessed how we face hypertension. The first reaction is always medication, and medication is necessary. But don't we all feel a sense of emptiness? As Mr. George, my 75-year-old patient, once told me, "The medication is the valve, Dr. Evelyn, but I want to know how to stop the boiler from overheating in the first place." Today, I don't want to talk about war. I want to talk about reconciliation with our own bodies. Hypertension is not a death sentence. It is a lifestyle choice we have the power to change. I will share the 12 golden keys that have helped thousands of seniors in my practice find balance again. We will dive into each key, one by one, leaving no detail behind so you can start applying them today. If you are ready, let's go into each specific course of action. 1. The foundational shift. Low carbohydrate lifestyle. The root lies here. I want you to understand that insulin is not just a blood sugar regulator. It is the gatekeeper of salt and water in your kidneys. When you eat too many carbohydrates, insulin spikes. It tells the kidneys to retain sodium and water. This directly increases blood volume and pressure on your vessel walls. To break this cycle, we must shift our eating philosophy, reduce starchy carbs below 30% of total calories, and prioritize high-quality, slow-releasing carbs. This is how you tell your kidneys, "You are now authorized to dump all that excess water and salt." 2. Eliminating sugar, sugar-free lifestyle. This is the twin key to the previous one, but even more potent. Sugar, especially fructose, is toxic to the cardiovascular system. It rapidly leads to insulin resistance, causes fatty liver, and directly damages the endothelium, the inner lining of your blood vessels. When vessel walls are damaged, they become stiffer and less flexible. Do you truly need that soda or that pastry in exchange for the gradual hardening of your arteries? I challenge you to eliminate sugar completely for 21 days. Listen to how your body responds to that cleansing. 3. Purging harmful refined omega-6 oils. We are living in a state of silent inflammation. Industrial oils like soybean, corn, and sunflower oils contain excessive omega-6, causing a serious imbalance with omega-3. This imbalance creates chronic inflammation, which damages the walls of your blood vessels. Mrs. Helen, a patient of mine, did everything right, but her blood pressure remained high. When we removed all refined oils from her kitchen and switched to extra virgin olive oil, her blood pressure began to drop because the internal inflammatory fire was extinguished. 4. Staying away from processed foods. This is where sugar, salt, and bad oils meet. Furthermore, processed foods contain additives like nitrites, nitrosamines, and various sodium, potassium preservation salts. These chemicals place direct stress on your detoxification systems and blood vessels. I want you to imagine, if a product has an ingredient list longer than a short chapter in a book, it's not food, it's a chemical experiment. Choose foods with 1 or 2 ingredients: eggs, vegetables, fish, meat. 5. Overall salt-sodium restriction. After controlling insulin, we must directly control salt intake. Although salt is not the root cause, consuming more than 6 grams per day is a habit that increases risk. Excess salt in the bloodstream can lead to calcium exchange into the vessel walls, causing the arteries to stiffen. Make a habit of reading labels. Hidden salt in bread, breakfast cereals, and bottled sauces often exceeds the salt you sprinkle on your food. Commit to bringing your total daily sodium intake to a safe level. 6. Boosting potassium, Kali. Intake. If sodium is the needle holding the scale, then potassium is the counterbalance. Potassium helps balance sodium in cells, supports optimal kidney function, and is a natural vasodilator, vessel relaxer. Instead of only worrying about sodium, have you prioritized enough dark leafy greens, spinach, kale, sweet potatoes, bananas, and avocados to supply enough potassium? Potassium deficiency is a common nutritional oversight in seniors that we need to fix. 7. Long daily walks. See walking as a moving meditation medicine. Walking helps reduce stress, activates sugar-burning mechanisms, and helps the body shed excess fluid. Just 30 to 45 minutes of consistent daily walking has been shown to help reduce systolic blood pressure by 8 to 20 points. This is almost as effective as a mild antihypertensive drug, but without the side effects. 8. Regular total body exercise. Walking is the foundation, but we need strength. Resistance training helps build muscle mass. Muscle is the body's best sponge, capable of absorbing sugar and improving insulin sensitivity. Don't worry about lifting heavy weights. Just use body weight exercises or light resistance 2 times a week. When you challenge your body with movement, you are teaching it how to manage pressure better. 9. Controlling chronic stress. Prolonged stress keeps cortisol levels chronically high. Cortisol is a hormone that retains sodium, holds onto water, and constricts blood vessels. A perfect recipe for hypertension. Create a mental safe zone just for yourself. Spend 15 minutes daily practicing deep breathing, box breathing, or meditation. You don't need to solve every problem. You just need to give your nervous system a chance to rest. 10. Ensuring 7+ hours of quality sleep. Sleep is your physiological reset button. While you are in deep sleep, your blood pressure and heart rate drop to their lowest point, allowing blood vessels to fully relax and recover. Are you proud that you only need 5 or 6 hours of sleep? That is an unnecessary sacrifice. Consistent sleep deprivation keeps the body in defense mode, increasing stress and vasoconstricting hormones. Make your bedroom a sanctuary of rest. 11. Considering appropriate nutritional supplements. Although I always prioritize whole foods, sometimes we need a little boost. Magnesium is a mineral I frequently mention, as it is a potent, smooth muscle relaxer which helps blood vessels dilate and lowers blood pressure. Never supplement blindly based on advertisements. Work with your doctor to check your micronutrient levels. Supplementation is only valuable when it is personalized and based on your body's actual needs. 12. Accurate home blood pressure monitoring. This is the final key, but it is the key to control and truth. Blood pressure measured at the clinic is often exaggerated, white coat syndrome. Buy a good monitor and follow the rules. Measure at the same time, morning, evening, after 5 minutes of rest, feet flat on the floor and back supported. Record this number not to worry, but to possess the powerful knowledge needed to work with your doctor. My dear viewers, this journey requires commitment, but it is worth it. I must reiterate my crucial warning. Absolutely never stop your blood pressure medication on your own. These 12 steps are your lifestyle foundation. They help you address the root cause, apply them, and only adjust medication under your doctor's strict supervision. Look at these 12 keys. They are not a burden. They are a promise you make to your future self. When your blood pressure numbers stabilize, that is the most eloquent proof that you have chosen to live consciously and strongly. Start today. I am Dr. Evelyn, and I am always here to accompany you. If you found this information helpful, please hit like, subscribe, and comment below, sharing which key you will start with first. I wish you a peaceful day and a healthy heart.